Dear colleagues, I want to share some thoughts with you. Why Femtis? The big question. Because the most important key to achieve a predictable refractive outcome is in fact effective lens positioning. But the effective lens positioning is not only Z-axis, which is back and front position. We also have Y-axis and X-axis. So how to achieve that? XYZ stability and positioning with predictable and stable result. It is the key important element to have predictable refractive outcome. So which your design which can achieve that? In my mind there is two options. Either we need to place the lens inside the capsule bag, as we do now and last 20 to 30 years, and the other way is to fix the lens on the back or on some structure which is stable on the back. So in the capsular bag we can imagine to have a lens with adjustable haptics configuration. So we will implant the lens and then we can fine-tune the position of the lens, adjusting the haptics which will keep the lens on that place. Why is that needed? Because the lens capsule is a bag. It is not a perfect sphere. It is with irregular shape, so every fixed shape of the haptics of the lens will be in contact not with a regular surface. So when we put the lens inside the bag, we actually don't know when it will sit, especially in large eyes like myopic eyes. So we need to have some mechanism of keeping the lens in the back in the desired position. The other way around is a lens with telecentric optic, which means that no matter the optical center of the lens, if it is aligned to the visual axis or not, the image refraction will be the same. So the telecentric optics are used in forensics, for example, and I don't think it will come any near to our clinical usage. So challenging design and production, and they are not available. So the next step is capsular bag. If we can fix something on the surface or of some parts of the capsular bag, maybe it will be the right way. So if we can fix optical element to the position, size, form of the rectus, this could be the answer. So it will be easy to be manufactured because it is just a groove on the periphery of the optic element, and it's already available. This lens is called Femtis. So we can achieve predictable refractive outcomes not only on Z axis. We can centrate the optic on Y and X axis, which is really important to have no lens tilt, no internal refractive phenomena like internal coma, like undesired and unsatisfactory correction of the toric amount, because everything which is not aligned with the visual axis actually is not correcting like it it is intended to correct. So it is really important for all toric lenses, refractive, diffractive, enhanced depth of focus lenses, mono and multifocal yaw designs. And another thing which I think is really important is that the nodal point of refraction of the eye with Femtis is closer to the iris diaphragm, and it provides maximum contrast transmittance because all the paraxial light rays would be diffracted and they will go to the fundus of the eye. If the nodal point is far from the iris diaphragm, some part of the paraxial rays will be stopped by the iris diaphragm. This is particularly important in highly myopic cases because they already have a lower contrast sensitivity. So this is a marking, corneal marking with 5.6 millimeter mark, which is aligned to the visual axis of the patient, or it is presumably aligned. And here I want to show that before putting a viscoelastic inside the anterior chamber, we see that the visual axis is not at all aligned with the pupil. This is corneal marking with the OVD inside. It seems like a little bit more centrated, but this is a hyperopic eye. After the surgery, the Femtis lens is placed and clipped over the intended size and position of the Rectus, and it sits where I wanted to put it, and it will be there according to the visual axis. Here we have a corneal marking without OVD on myopic eye. We know that the angle kappa in myopic eye, or the angle of the visual axis, is less aside from the corneal apex. So here is the Femtis which is clipped on the Rectus. It is aligned according to the visual axis, and we don't expect any movement on Z axis, X axis and Y axis. Here we have a corneal mark, again hyperopic eye, and we see that the Rectus is a little bit far from the center, and this is the patient visual axis. Then now you see the lens which is inside the back, and you can appreciate that the Rectus is not over the O optic of the lens. Why is that? We see that there is absence of any centration, no relevance to size, form and position of the Rectus, no positioning according to visual axis. And despite that the Rectus is created and positioned according to the visual axis, we have not achieved the optimal position of the lens for that eye. But we have circle, perfectly aligned Rectus without any relevance to the position of the lens which is inside the back. Why? Because the back is not with regular shape. We see on the refractometry printout that we have perfect Z ELP alignment, but we have X misalignment, and we are not over the peak of the toroid of the toric lens. We are somewhere on the slope. That is why we have undercorrection and rotation of the refractive cylinder, which is like a cross cylinder. So here is a demonstration how misalignment of the toric lens is affecting the maximum refractive outcome. This is particularly important also in multifocal toric lenses, and the XYZ ELP centration is really important thing to be aware of. Hyperopic eyes can have a lot of variation, as we know, of the visual axis according to the pupil and cornea. Myopic eyes are less common but not immune to variation of visual axis, and Y and X centration is important to achieve exact toric and multifocal correction. Why? Because if the lens is diffractive, multifocal, bifocal or trifocal, if it is not aligned with the visual axis, we can come up with situation when the visual axis is near to transition zones or over the first ring. If the lens is with asymmetrical refractive design, we again can have problems with the visual axis because it again can be on transition zone, and that will lead to undesired refractive phenomena. If the lens is enhanced depth of focus, no matter diffractive masks or something else, again it should be aligned to the visual axis, because any decentration can cause internal coma or other phenomena that will degrade our end result.